Welcome to patient orientation class. My name is Dr. Chris Rush. Welcome to Healing Hands Chiropractic. So welcome, ladies. Y'all are so great. I appreciate you being here, especially after a beautiful day here in the Ocean City area. So the reason why I have you here is not to take you away from happy hour tonight. Hopefully I'll get you out before happy hour ends. But what we have is called a patient orientation class. What it is some of you have been to chiropractors before. Some of you don't know exactly what a chiropractor is, what we do at this office, what's that instrument we use, why do we offer not only chiropractic, but nutrition programs, Zing program, stuff like that. That's why you're here. We're going to explain all that to you. So I have a slideshow that I'm going to show you as well, but you don't have to look at there because I'm just going to talk about the slides that I see, but those packets of information that you have. In fact, let's take a look at those packets, make sure that they're yours. In any case, those packets should have your name along the side. Also, it should have red circles on it. Those red circles indicate what issues you came in with. Now, some of you came in with neck pain and you have circles in your back area. Some of you came in with back pain and you have circles up into your neck area. But I don't want you to just to focus on the pain because that's what brought you in here. What we're going to do is transition you from a pain model into a functional model. Now, what does that mean? Well, the reason why you came in is because Dr. Chris, I hurt here. And so that's why we sat down in the consultation room, figured out where that pain was, took some pictures of that, did some range of motion with it as well to see exactly where you would be. And so we showed you those pictures, used our activator, adjusted those bones into the proper place, and hopefully you felt better and you moved better. But not only do we want you to get out of that feeling better, we want every organ on the inside to function better. And that's what those red circles are indicating, because if you came in with neck pain, then you have those other organ issues going on in that far column there. Now, not all of them, but you might say, well, why are my sinuses, jacked up? Well, the reason why your sinuses are jacked up, it could be possibility that it's a nerve component, all right? So what we want to do here in the class tonight is called Turn Up Your Health. So you see you have a dimmer switch there, right? So what does a dimmer switch does? It controls the light going up and down. Well, if there's a bone or a disc on that nerve, and that brain of yours is trying to communicate to that eyeball, for an example, and if that bone or disc is on that nerve, do you think you would be able to see well? Well, no, you wouldn't be able to see well because that nerve is being compromised. Again, going to the furthest extreme, if I was a surgeon and I would go in there and I would cut the optic nerve, the nerve to the eye, obviously we wouldn't be able to see. So think of that as the bone or the disc on the nerve, and we're using our activator to take that pressure off so you can feel and function better. All right? So tonight's class, what is health? Where does it come from? How do you find it when it's needed? And to get the most benefits from your care. And that's what this supplementary paperwork that you have in your hands. So it doesn't go with the slideshow, but what's going to happen is I'm going to talk our way through these pages that you have. These pages obviously are yours to keep. The pen's a gift as well. If you wanted to take notes, you can with it, or if you wanted to give it to a friend or a family member, you can do that as well. All right. Difference in healthcare models. We're going to talk about trauma, stress, toxins, spinal neglect leads to poor health, quality of information, the quality decisions about your health that you're going to make. And I want to make sure I have your permission before we go further. The reason why I ask about the permission is it's a little gimmick on the slide, so right? No, you're fine. So the reason why we ask about the permission is I'm going to introduce some topics to you, some points of discussion, and hold your questions till the end or to the end of the slide. The reason why I say that is because while I go through it, I might answer those questions as well for you. All right? So the difference in healthcare models. So you might have been to a chiropractor before, but the difference between us and a medical doctor is we want to do the least invasive, not prescribed synthetic medication for you, and also not to do the more invasive procedures such as surgery. So that's why we are chiropractors, because we feel that when mom and dad's half cells came together, which you can hopefully still see in biological books today, right? The most important organ to form is the brain first, then the spinal cord, and then the spinal cord shoots off nerves to every bone, muscle, ligament, every cell of our body. In fact, not to be gross, because I know you haven't eaten yet, but if I would peel back my skin and leave my nervous system, you would still recognize me as Dr. Chris. A thinner Dr. Chris, but you would still recognize me as Dr. Chris. So that's how many nerves we have, and if you've ever been to those human body exhibits and stuff like that, that's really cool to see. Don't go on a full stomach, maybe go on an empty stomach as well, just in case, but it's pretty cool to see that everything is complete because of our nervous system. So that nervous system shoots that signal, meaning the brain, down, and I'll just talk about the eye since I mentioned about the optic nerve already. So that mental impulse from the brain along that optic nerve is developing that eyeball, and the eyeball is sending the message back to the brain. Well, as I look around here, all our hair is in the same place, our eyes are in the same place, hands and feet are in the same place. So that's why here in this office we trust the wisdom of our body, the power that made the body heals the body by Dr. B.J. Palmer, to keep us together. So that's what makes us different than other healthcare models. Trauma, stress, toxins, spinal neglect leads to poor health. We know that. Quality information, that's what we're giving you tonight. So again, I just want to ask your permission to go forward. So this means yes, this means no. Everyone's shaking their head yes. All right. So, the problem that we have is health is judged by how a person feels. So people feel that if they're pain-free and symptom-free, they're unhealthy. Well, guess what? If you go to a dentist, now again, an older dentist uses the mirror. I don't know if they use the mirror anymore, but they usually have a shepherd's hook, they're called, or a pointer. And they will check your teeth. In fact, that's a dental exam nowadays. But when they find a bad tooth, you know it and he knows it or she knows it because you'll go, ow, right? So the bad tooth didn't just happen to be bad at that point, it grew to be bad, whether it's gum disease, whether you need a root canal because of deterioration on that nerve underneath, so on and so forth. So again, heart attacks, just like teeth, people are diagnosed with heart attacks when they go to the hospital. Usually you don't get a diagnosis of a heart attack when you're standing up in front of a lovely audience speaking about chiropractic, unless I would go to the emergency room. So I want you to transform your thinking, and yes, why you came in here was pain-free, but we want you to have better function over all those organs on the inside as well. All right? Any questions? So, fallacy of feeling good, leading cause of death and early symptoms. Number 1, heart disease. There's no early symptoms of heart disease. Number 2 is cancer. There's no early symptoms. Again, when they're diagnosed, it's usually when you go to your medical facility and they'll diagnose that, and then also stroke as well. No early symptoms. All right. So, pain and symptoms. So think about this. Now, I don't know if any of you have experienced this before, but if you've ever reached to touch a hot stove and your hand gets hot, you pull away. Well, that is a symptom. So the reason why I'm showing you this is because if you have a fever or you ingested the bad food or the tainted food or touched the hot stove, you want to pull your hand back for the hot stove. For the fever, you want to let that run through your body, so it's elevating, trying to kill off things in your body. That's why you have that fever. Or as that picture is indicating, you know, she doesn't feel so well, so she's getting rid of that bad food as well. So health equals health optimal function. Not one definition that defines health is based on symptoms or how a person feels. So we talked about that innate wisdom, that inborn wisdom, innate intelligence, and the structure equals your healthy expression. So, you know the man on the right, on the left there, that's Billy Joel. And so what's happening is he knows how to play that piano, right? Multiple songs, multiple hit songs. And then because of that song expression that comes at the end, I know the person in there is not liking it too much, but that health expression is either a beautiful song, or if he's not hitting the keys properly, it might be a collaboration mess. All right? So we're allowing that innate wisdom inside of you to express itself. Us as chiropractors in this office, we're correcting the structure, and hopefully we'll get that expression of health out of you with less symptoms, but better function of life. Again, health is not about the symptoms. It's all about the function, the structure allowing proper function. Health is your birthright. You know, it's amazing. Some of you are my patients, and you deserve to be healthy. You really do. I don't want you to suffer needlessly. So what limits our body's ability to function properly? Well, we just went over it. Only one organ is totally encased in bone. I'm not knocking on wood. Controls everything in the body. If you don't have brain signal, or brain even, you have no life. That innate intelligence where mom and dad cells come together to form us, and that, like I said, the group that we have. The second most important organ in the body is the spinal cord. It connects the brain and the body together, almost completely encased in bone, meaning the spinal column, but also the bone's there for protection, but also the movement as well. So you have three parts to your spine: cervical spine, thoracic spine, lumbar spine. Also, a lot of people, when you were younger, you fell on your tailbone. Well, that's called the coccyx, or your sacrum bone. And you see you have 7 cervical vertebrae, 12 thoracic vertebrae, 5 lumbar vertebrae. So that's what's also indicated in those packets that you have in front of you. There's intervertebral discs in between the bones. Spinal nerves come out the side. They exit the spinal canal. And then you can also have the spinal misalignment. So again, that bone or disc on the nerve, but also stress to your body. You can see all those are what? Traumas, right? Childhood trauma, playing football or sports. Unfortunately, some of you played musical chairs where they'll pull the chair out from underneath you and sit in it, right? Maybe you've fallen off a bike, you've had some falls and tumbles. So again, causes of spinal misalignment. I know everyone's only 29 in the room, right? So you have some adult injuries who fall on the ice, fall on the stairs. Maybe you are playing some sports. Lifting injuries. Actually, there's a new one called text neck, right? Cell phone use, computer use. Repetitive motions, bumps and jars to the head. Car accidents are a cause of the spinal misalignment. Low impact speeds can be dangerous, and there's delayed side effects. So why I say delayed side effects? Have you ever thought, well, I should ignore this pain and maybe it'll go away? Sometimes if you do ignore the pain, it doesn't go away, but it's building up that degeneration process in there. Also, other causes of stress to the spine. You can see the Cheetos Crunchy, right? The Flaming Hot, which is the #1 product of snacks these days. Believe it or not, toxins in your body, so whether it's medications or just natural toxins in food, stress, and cumulative effects. How many times over and over? Now I know you all are only 29 in the room, but on the left-hand side there, that's Superman. That was Christopher Reeves. He had a horse injury, meaning he fell off a horse, landed on his head, and you can see how his neck was severed. Right there, right at the base there, C7 and T1 there. Let me see if this red pointer. It disappears on the blue. You can see it right there if I can, right into that area. So you got that surgically repaired. Food in our body can also, if you ate at McDonald's, 7 days a week, do you think you'd have some digestive issues? This means yes, this means no, right? All right. We talked about subluxations, the misalignment of the vertebra and the swollen disc. Areas that could happen there are pain and tenderness, inflammation or swelling, tight muscles. Now the pain and tenderness is a symptom, just like the bad tooth. You know, if I use that shepherd's hook and touch that tooth, you'll feel some pain and tenderness. So if they pull out the tooth, what's underneath it? Well, the inflamed nerve, it could be a swollen gum, and then also tight muscles as well. So that's the same that happens around that spinal cord as well, meaning even when the nerves exit out the side, or the cord itself when it drops through down from the brain. Locked joints and reduced motion, that's when you can't turn your head or neck in certain directions. And then I think one of you ladies talked about abnormal posture and abnormal heat. So the abnormal posture, you're noticing a difference because we're pushing on those bones and discs to get those into the right place. Dr. Sue, he's a spinal expert out of the University of Colorado. I'm not sure if he's there still, but he's still alive. Subluxations are very real. We have documented it to the extent that no one can dispute its existence. You see he has a dime in his hand. So the weight of a dime on a spinal nerve will reduce the nerve transmission by as much as 60%. So just that small amount of pressure can cause the subluxation as well, or the disrupted signal, I should say, from the brain to the eye, for example, and the eye back to the brain, like I mentioned about that optic nerve. From the Journal of the AMA, or the American Medical Association, deviations in the body's center of gravity, meaning poor posture, have resulted in intestinal problems, hemorrhoids, varicose veins, osteoporosis, hip, foot deformities, poor health, decreased quality of life, and a shortened lifespan. So that matches what you have on the first page of your sheets. Okay, 4 frustrations. You put it off, the problem getting checked. Sometimes you have that leaky roof. As you can see there, this is a ceiling, and this happens to be the water dripping on it, right? That's what that brown spot is. It's not the floor, it's the ceiling because of the crown molding, all right? Anyway, usually where it's leaking, it's not usually directly right above. So we want to get to the cause of it before it becomes a problem, as you see in the next slide there. How do we get that to that stage, meaning where it's raining in our kitchen so bad, or maybe our body is so bad, maybe it will go away. Oh, I thought this was normal because I'm getting older, chronologically, right? Common sense and reality, something only goes away when what is causing it goes away. So that's why we address the bones and the discs of your body to take that pressure off those nerve arteries and veins so you can feel and function better. 4 frustrations that you have. You know, you came in here, I know chiropractic was your first stop, you didn't all then go to the medical doctor first, right? So covering up the problem, there's some NSAIDs there called Tylenol and Advil. And the reason why we have all those slides there like that is some people ignore that check engine light. Some people who are cooking in the kitchen will disable their smoke alarm. So it's really covering up the problem. So a lot of NSAIDs, Tylenol, Advil will cover up that problem, and you have the degeneration going on. So if you go towards your next sheet that you have, those are not your x-rays, but that's when you came in to see us here at the office, meaning where your spine is. So there are 4 columns across there. Normal is the closest one to the left. The furthest one is stage 4. Stage 4 is the frustration that you have because you've waited so long that in stage 4, the vertebra and the bones are solidifying there. And so that's a more difficult case. Usually that happens approximately, it'll go from 28 years to 40 years of damage, right? So what we're trying to do is to push onto those bones and discs to get you as back to clear as normal as possible. How do we do that? We use our activator. Also, we use other instruments as well to get that spine into better alignment. How do we know we get it in better alignment? That's why we take those pictures of you, meaning the x-rays when you first came in and down the road at the relief phase. And then we have the 2 more important phases called the healing and the rehabilitation phases. We don't want you to end up 6 months to a year down the road with those issues at all. So that's why we have those additional appointments. So what frustrates us here at our office is It's difficult, I know, in this day and age that people miss appointments. Well, remember, it's just like baking a cake. You see the different layers in there and the peculiarness of the cake, because it is checkerboard. I don't know how to do that personally, but that's pretty fancy there, I would call it. So what ends up happening is you know, you have to have the right ingredients to end up with a masterpiece of a cake like that. And if you continue to miss appointments, it's going to be frustrating, not only to you, but to us, to help you get into a situation where you're out of pain, but you're feeling good, and also better function. No link with that. You can see how good that cake is. A lot of us are in too big of a hurry to get well. Healing does take time. That's why up on our one wall we have that quote. There's a 90-day principle of healing there. Actually, Dr. Sue helped discover that as well. It takes approximately 90 days for that nerve to regenerate. And obviously you can't rush nature. That's why you come to Doctors Chris and Tracy Rush to help you out.
That's good.
Here's a healing timeline up there. You can find that online as well. But again, just stressing the importance of where you need to go from when you first start healing with the adjustment, and then again, how it improves. And see there at the end there, I know it's difficult to see because my red pointer goes in and out, but it's 2 years right at the end. But 90 days that you'll have a noticeable difference. All right, principles for a healthier life. Health is your birthright, remember. So conception, when mom and dads come together, cells, they're half cells. 51% of dad cells contributed to you, 49% is from mom. So if you're ever on jeopardy, dad gives you a little bit more, all right? There's the notochord that develops. The notochord develops and forms all the cells in the body. It becomes the central nervous system, where I was talking about that earlier before. Again, it's your birthright. You do have an incredible nervous system. The nervous system controls every process in the body. The heart, the lungs, the digestion, temperature are automatically controlled. Body's in a constant state of cell replication and healing. And every 7 years, yes, every 7 years, we do get a new body. Again, and that's why we also talk about nutrition, because of what we put into that body, hopefully not McDonald's 7 days a week like I mentioned earlier, is helping us to rejuvenate so we can get a new body in 7 years. Now, does it all come together? Well, that's why we want to make sure that nervous system is not interfered with. Proper communication between that brain to every cell of our body will unlock that fountain of youth. Journal of Neurological Science, the quality of healing is directly proportional to the function and capability of the central nervous system to send and receive nerve messages. U.S. healthcare system, meaning the medical system, has the most extensive healthcare system in the world. We have the most doctors, best medical schools, top hospitals, most advanced technology and equipment. Emergency trauma care is #1, but only 1%. What does that mean? Well, the other 99%, meaning where we fall into category, we're 79th out of 81 countries. So what does that mean? So #1 in emergency trauma care, healthcare crisis, we're #1 in. But what happens is preventative or to make sure you're functioning properly, we're only 79 out of 81 countries. Pharmaceutical model, again, 80% of the budget's on marketing. Americans spent $300 billion on drugs last year. Combined profits of the top 10 Fortune 500 pharmaceutical companies is higher than that, but it's $36 billion plus. Remember, Americans are 79th out of 81 countries on total health index, even spending $2.7 trillion on healthcare. So it's your health, or are you Merck's stock value? We also have some questions about, does insurance pay for this? Yes, believe it or not, insurances do cover chiropractic, Medicare, Blue Cross Blue Shield, but what happens is if it's your fault, don't you have to pay something out of pocket to help you get something restored? So as you can see, the roof on the right hand side, the car crash on the left hand side, what ends up happening is Yes, your insurance does kick in, but you might have a deductible. So what ends up happening is we want to make sure that you're responsible for your health, because if you've ever dealt with an insurance company, you know they're in it for what? The bottom line, not necessarily your health. So we do verify insurance for you, and here's the guidelines that they operate under. A treatment plan that seeks to prevent disease, promote health, and prolong and enhance the quality of life. Sounds like what we do here at Healing Hands Chiropractic. Or therapy that is performed to maintain or prevent deterioration of a chronic condition is deemed not medically necessary. So again, we don't want you to roll the dice. We don't want you to roll the dice, and we're not going to roll the dice for you as well. So we're going to take good quality of care for you, we're going to spend time with you, and we're going to have different financial plans to best suit your budgeting needs. And why we say all that is because the purpose of chiropractic is to remove the interference, to allow proper nervous system communication within the body, have proper cell replication and healing. Remember, 7 years, new body. Proper function, so you can have a functioning from head to toe. And overall chronic health, right? Not chronic disease, but chronic health. So a couple pictures for you. We've been here for 20 years, and as you can see, in 1990, a patient came in with a flattened cervical neck. It's flattened towards the bottom there. Let me get my red pointer here. You can see how it's flat here, right? In this one here, after 17 years in 2007, you can see how that neck is starting to curve. But you know what was interesting? This was a hairstylist here. So the hairstylist in 1990 couldn't lift her hands above her own head, let alone someone else's head for so long. And in 2007 here, even though, you know, from your eyes, you don't see a huge change, but there's a curve in there now. Now she's actually able to lift up her hands and have her own salon and continue to do that for her well-being. Again, another example, 22 years in the making, right? 1984, similar situation here. You can see how the neck started in 84, right into that bottom area there. Some flattening, some other complications happened in between, came back 2006 there, a little bit older. But interesting enough, this person was concerned about head tilt, so they were looking down for so long. Now they're able to look up. And I know it's difficult to see, but you can see how that mandible or that chin is down here. This is actually up and looking up now. So he was looking down at his feet all the time. Now he's looking up. All right, another patient example as well. This is in the mid-back area. And so, again, how chiropractic started to straighten that spine, even though there's still abnormal twists and turns, you can see in the right versus the left there. You can see how this person is now possibly better, according to their picture, but they're leading a full life here on the Eastern Shore because there's less interference in that brain-body connection through that nervous system. Juan Ramirez, you can see how he has a spondylo. That's what this is indicating here. A spondylolisthesis is the L5 bone moving on top of the sacral bone. It's reduced. Now he's able to have his own gardening club. And then when I say gardening club, he uses that now as a mode of income for himself. And he has other people to help him because his back does get sore. But what's interesting is even with that happening there, I don't know why that just happened. With that happening right there, he was doomed because he was going to go into surgery to get that surgically corrected. Well, surgically corrected means that they're just going to put pins and bones in that area to get that stabilized instead of chiropractic, which brought that back, as you can see, 4 millimeters approximately. Again, Lauren Chambers. You can see how the head is starting to come upright, and that mid-back is a little bit better, but still having some issues. Now she's able to teach. Shelby, you can see how that lower back, but you see the gas that's going on in there. That's what those bubbles are. Those aren't tumors or anything, constipated. Starting to getting that spine into the correct position. So the first one on the right side now was when she first came in. The second one now, you can see how it's straightened out. Still has gas, but not as much. Able to go to the bathroom, not debilitated by the constipation, as you can see. All right, so Carolyn came in, she was 77, the young age of 77 when she started care, right? And so you can see how her neck was and how her neck is. What was interesting with this case there, she wanted to play golf with the women on Tuesday mornings, and her neck hurt her after just 9 holes, because that's what they play, 9 holes. And after this, she actually won the tournament for her club. Maria, again, you can see how bad that neck is. You can see how there's a curve restored. And the reason why I show you that one is because that was a near dear friend of ours here at the clinic, was having mental issues as well, was disciplined a lot at school. The school called us and said, "What are you doing to her?" And I said, "What do you mean, what are we doing to her? We're getting her life back, Maria's life back." And she said, "Well, whatever you're doing, keep on doing it, because she's behaving better, she's doing better in school, so on and so forth." So a lot of good stuff there. That was Maria. So, arcs of life, you can see an increased thoracic hump or loss of cervical arc and mortality, meaning if you were leaning forward or concerned about the dower's hump on your back, right, leads to more mortality. Research shows that a loss of curve in the neck, increases of the normal mid-back spinal curve, increases mortality, speeds up death, and takes up to 15 years off your life. So again, I know this is, you came in because of maybe vanity, but again, we want to save your life and add years upon it. That slide is showing you the disc, where it was when it first came in on the right-hand side, and now on the left-hand side. You can't take action, and what I mean by that is if there's a couple more sheets that we're going to go over here, but as I'm talking, names could have came up to your mind and stuff, so I'd like to offer you a special here at our office. We do offer a $59 special here through patients that attend the POC class, patient orientation class. The reason why we do that is because, you know, you might have come in because, oh, this was normal or this was aches and pains, but it's a lot deeper like that. Some offices have the iceberg at the top, and you can see how large the iceberg is really underneath the surface of the water. So again, we want to try to get you so you have least invasive care into, or more invasive care to least invasive care. And you might want to request more information. We can give that to you as well. So as we go along and finish up into this packet, go ahead and flip to the page after the subluxation degeneration page. That shows you the nerves, right? And again, just stressing to you is good health does not mean that you're in pain. Good health can happen if you're subluxation free. So you might not feel the pain during a subluxation because it's only a small portion there on that sheet. And so it could be affecting your organs on the inside. It could be giving you some muscle spasms and fatigue. But good health is equal to healthy function. So that's the importance there. If you flip to the next page, it's your exercise, or it's your healthcare instructions. I'm not going to read those to you. You can read those when you go home. But 3 things I want you to remember on those sheets is, number 1, continue your normal routine. Unless Dr. Tracy and I told you not to do your normal routine, we would have given you restrictions. But continue to do your normal routine. The reason why we do that is we want to make sure that it's the adjustment working, not because you're taking it easy or doing anything different. Number 2, make sure you get your quality of sleep. Why? You should sleep around 6 hours a night. Some of you don't. I usually don't, and the reason is because I have to go up and use the bathroom. So what happens is I try to get out of bed without waking Dr. Tracy, use the bathroom, and get back into the bed without disturbing her, and trying to get back to quality sleep as best as I can. So the reason why I say that is usually about 6 hours, because we're not robots. We can't plug ourselves into the wall and recharge that way. 6 hours is that 7 years of healing coming upon us, because our brain is taking out the bad stuff and bringing in the good stuff. All right. The third thing to remember is also we're going to ask you a lot of questions. Those questions aren't to pry into your life, but to try to figure out exactly what's causing your subluxation pattern. So real quick, I have a patient, I'll just call him Bubba. Actually, his name is Bubba. But after his adjustment, he would have no neck pain. But when he would come in for his next appointment, which was a Wednesday, he would end up with that neck pain. So I would ask him a bunch of questions. And I didn't want to get him irritated then to me, because he was 6'8", he was about a good 300 pounds, and I didn't want to get him upset. But I have to ask you these questions, Bubba. So what do you do when you leave the office? He goes, well, I go down to the Friendship Exxon, I get a six-pack of beer, and I fuel up my truck if it's needed, and then I head home. And he goes, are you upset with me with that? And I said, no, I'm not upset with you. You can do what you want. It is still America, last time I checked, right? And then he goes, well, when I get back to the home, I put the 6-pack on the table. I didn't put it in the fridge because I'm going to drink it. And then I look up at the TV. And I said, exactly how you showed me, Bubba, where does the neck pain hurt? He goes, right here. And he goes, do you think it's me looking at the TV? I said, it could possibly be, Bubba. So let's do this. Let's just switch the chair so you're facing the TV, and let's have you turn your head this way, which is the opposite direction of where that neck pain was. And guess what? Bubba, he was going to go hug me, but I told him not to. But he goes, Doc, you're a miracle worker. On his next appointment, my neck doesn't hurt me anymore. So I don't want you to get upset about Dr. Tracy and I asking you a lot of questions. In fact, that's why we have doors on the rooms to ask you these questions. All right. So that takes care of that sheet. A lot of patients ask then, well, what happens at the healing and the rehab phases? Well, the healing phase, you'll still receive chiropractic adjustments. And at the rehab phase, that's where these exercises are coming in. Not all of you have to do the neck exercises or back exercises, but the reason why we put those in there for you is Dr. Tracy and I are going to assign those to you. We also have shoulder exercises. We also have feet exercises. We also have hand exercises. We have anything that has a joint in your body we can exercise. So the reason why we do exercises towards the end, how many of you have been to a physical therapist before coming here? Some of you have. So I know it's difficult to see, but where our office is located, next to us used to be the firehouse, and then they built a new firehouse next to this old building, older building. Not our building, but the building that the old firehouse was in. And I think, Miss Ann, you might be able to see it, but beyond the boat building, which it is now, there's a telephone pole, and it's a new birch pole. It's not a creosote soaked birch pole. The reason why there's a new birch pole in there, don't worry, I'm going to explain to you why we do the exercises here in a second. But the reason why we have a new telephone pole there is because one of the trucks that was building the building, or it could have been a utility truck itself, backed into that pole. So how they fixed the pole was they took the lines off the pole, put them on the ground, took the broken pole out, and then put the new pole back in and reattached the lines. So they didn't try to attempt to pull on those lines to pull the pole into a straight position. So that's why we prescribe exercises to you towards the end of your care, is because we want to straighten out your spine, we want to level off your shoulders, your head, your pelvis, then strengthen those muscles along that area. And when we strengthen those muscles along there, that will help tether that spine, that pelvis, into the correct positions as well. So that's why we don't give you additional exercises to do in the beginning of care, because we want to take a look not only in the beginning of your care with an x-ray, at the end of your relief care with an x-ray, but then we want to strengthen those muscles and ligaments to keep your spine, your pelvis, your shoulders, your head in the right place. Does that make sense now? So that's what differentiates us from a physical therapist. So, going through all those pages, there's going to be a page at the end there where you're going to put your name, your date that you attended, and then 3 questions. Was the information useful? Was it presented in a professional manner? And I forget the 3rd one there off the top of my head. Oh.
Did you learn something?
Yeah, did you learn something? Some of you might have been aces on this chiropractic, but as you were looking at the slideshow, also hearing me talk as well, maybe you got a gleam, another gold nugget that you were told, since you guys are only 29 years old, right? Maybe when you were 25, right? Just to reinforce it. Also, if there's any suggestions or comments, like maybe I should have had food here for significant others, right? It's almost close to the end of happy hour time, right? We need to get out. But any suggestions and comments? If you want to write the person's email address that you thought of, or if you want to give it to us later, that's fine too. The reason why we offer that is because we have this also presentation on video, but they also can get a packet of information like you have here to help explain, because we don't want you to be the in-between person. Well, they use this instrument called the activator, and you know, it seems like it's a staple gun, so we'll help you avoid all that by just telling them, hey, give them a call. They'll be able to help you. If you have any questions, they'll be able to answer those for you as well. Ladies and gentlemen, if you have any questions, I'll be able to answer those for you. If not, you're free to go. Just rip off that back page. That back page is going to be put into your file here at the office. We have to do that, just make sure that we had this education class for you as well. Any questions? Well, thank you. Hope I got you out before happy hour ended. Have a wonderful night. Blessings to you all. If you do have any questions you want to ask me after class, you're more than welcome to. Also, if you have any questions for the prettier doctor, Dr. Tracy, you're more than welcome to ask those, and she'll answer those for you on your next visit. Have a wonderful night. Enjoy. Make sure you take the pen, the packet of information that's going to be prescribed to you at the end of your care for those exercises as well. All right? Have a great night. Enjoy.
Thank you.
You're welcome.
Have a good night.